Are my tear troughs too hollow to be filled? I cannot afford fat grafting, but was told fillers are too dangerous. Was booked for Restylane for my tear troughs, but went to another dermatologist to get a second opinion. She said fillers are dangerous and risk blindness, and that it is too difficult. She is a highly respected surgical dermatologist. Said my thin under-eye skin mixed with fat cheeks, the amount of filler needed would make me look like I have edema, make my eyes look worse and even darker, and that there's nothing I can do to correct it. Can't afford fat graft. Is there anything else I can do?
Thank you for your question. You submitted your question with several photos, and you stated in your question that you had been booked for a Restylane injection by a dermatologist and that you went for a second opinion from another dermatologist, and that dermatologist told you that the risk of blindness from Restylane injection in this area, the tear trough, is important, as well as further describing that because of the thin skin and, quote, fat cheeks, as described in your question, that you would end up looking like you had swelling or edema, and so that there was no benefit from this doctor's second opinion. And you stated in your question that you cannot afford fat grafting, and so you want to know what you can do. Well, I can certainly share with you my perspective on this type of issue. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with the under eye area, whether it's surgical use for under eye bags, as well as the use of injectable fillers for tear trough or under eye hollows, has become a very significant part of my practice, and I have a lot of experience with this, as well as dealing with the complications of injectable fillers as well as surgery in this area. Having an eye surgery background and understanding eye anatomy is relevant in this discussion, first to address the risk of blindness. So to begin with, yeah, there is a risk of, quote, blindness, which has basically been described by the placement of injectable fillers in this area as well as other several facial areas in the medical literature, and unfortunately is something that doctors do report periodically with some consistency. But the risk is not only very low, but it is also very much has been associated with the technique. And as much as doctors get kind of sensitive about who has a better technique, I can tell you there are methods that lower the risk significantly. So in my practice, when I place filler in the tear trough area, I routinely use something called blunt cannulas. And essentially, one of the anatomical issues with the placement of filler that results in blindness is often the result of a filler being injected directly into a vessel that will go back into the space where the vessels go to the eye. So when you use a blunt cannula instead of a needle, you're actually avoiding that potential penetration in the vessel. Not impossible, much less probable. So I would not dissuade you from doing this because of the risk of blindness. Now, as far as this doctor's opinion about the potential for an edematous or swollen look, well, there's a certain degree of potential of that occurring. We have seen many patients who have had similar situations where, in the valiant attempt to help under eye hollows and to hide under eye bags, the person can look more swollen and look like their bags are even bigger. But at the same time, there is certain ways to actually minimize that potential as long as there's clarity about the kind of outcome. So, if you have on physical exam very prominent under eye bags, well then you're more likely to be a better candidate for a lower eyelid blepharoplasty. But if you have a minimal to moderate amount of fat prolapse and you have a relative hollow, then fillers can be placed into that trough area and to soften and blend that area without making you look swollen or edematous. Again, it's the art of the procedure, the art of placement, it's the art of choice in the type of filler. And so that's where different doctors bring different ideas to the table. I think that as far as your concern about not being able to afford fat grafting, well, this can be in a way, and from my perspective, a blessing in disguise. I think that the fat grafting in the tear trough area, in my opinion, is not as predictable and often results in irregularities and lumps. So it actually dissuades you from doing fat grafting. I would say meet with doctors, and I think that if you really want to be cautious about relative risk of blindness, well, it kind of stands to reason to go to somebody with an eye surgery background and who understands eye anatomy. This is where an oculofacial specialist, like someone who is board certified or trained in ophthalmology and then trained in oculoplastic surgery, may be the type of doctor that you'll feel a little bit more comfortable with if this fear of blindness is there. Again, it's also about the doctor's experience and style and what methods they use. As I said, because I use blunt cannulas and I am really a cosmetic surgeon, I routinely do this procedure, and so with that comes, of course, experience. And so you have an opportunity now to maybe meet with another doctor who is more specialized in the eye area to maybe help you manage some of your concerns. But I would say that respectfully, I would disagree with the second opinion that you received, and maybe, again, try someone who will be more comfortable with this idea. And as is the case for many things in this arena, you have to learn, you have to have a good meeting of the minds between the doctor and the patient. And for me, as a physician doing this for my patient, there's kind of a getting to know the patient process where I see the patient, I follow up in 2 weeks, I evaluate the results, I compare the before and afters, and my patients and I get to have long-standing relationships so that I'm able to do things with some consistency for them. So I hope that was helpful. I wish you the best of luck. Thank you for your question.